I'm the President and CEO of National Healthcare Advisory. Thank you so much for joining us today. We've got a lot on our plate. Attorney Grudzien, who is quite arguably one of the best benefit attorneys in the nation, has also done mergers and acquisition, is going to be speaking for us today. He brings a lot of talent to the table. Also, I want to introduce National Healthcare Advisory. We're a consulting firm focused on healthcare cost reduction. We're just saying from a common sense perspective, if you take 90 to 100% of your healthcare cost and you push that through an expense reduction tool, your PEPM trend is going to go down. And we do that through superior plan design, medical concierge, pharmaceutical benefits management, 24/7 physicians on call, wellness, etc. We implement all of this out of realized savings that we find, so no capital budgets are ever required to start the process of discovery. And now for some more updates and information that's relevant today, I'd like to pass it over now to Ron Dobrovich, who is our Chief Information Officer and our Chief Plan Designer. Ron?
Thank you, Joel. As Joel had said, we do plan design, consulting, implementation, and specialty products, and work with NHA through my years of experience in the marketplace, both nationally and regionally. There was one name that kept coming up as a benefit attorney, and that was our speaker today, Larry Grudzien. And he is not only a benefit attorney, he also brings expertise in the area of a tax attorney. And I don't think there are two greater skills in today's economy right now than to know something about benefits and taxes. And without further ado, I'd like to pass it over to Larry Grudzien.
Well, thank you very much. I appreciate it. Folks, this is an extremely important discussion because for the first time in 40 years, ever since the passage of ERISA in the 70s, legislation affects all types of health and welfare plans. It affects individual products, group products, self-insured products, insured products. And for the first time, the federal government is going to get between you and your insurer to tell the insurer exactly what the product has to contain and who has to be receiving the benefit. Before, the states were in charge of this. Now the federal government is going in here, and this area is extremely complicated, confusing, and frustrating. And the reason why it's frustrating is because there's certain aspects of this legislation that we don't know what to tell people because the legislation was drafted so poorly. And one thing you're going to see in this discussion, there is a ton of effective dates. It's hard to keep all this down. And I'm going to try to go through it and explain to you exactly what is due when, who's going to have to do what, and who do you do to. And that's what we're going to try to do today is give some sense of this. But again, it's an extremely confusing area. And there are many pockets of this law that are still unclear, and that's what's important to understand. So please remember that. Now, what are we talking about here? Slide 2 talks about exactly what is contained in here, and basically we're talking about two bills. First of all, what we're talking about is the Patient Protection and Affordability Care Act, or H.R. 3590. This is the over 1,000-page monstrosity that's been advertised. It was passed by Congress on March 21st, signed into law on March 23rd. That's the date of enactment of that law. And some people reported that. Well, a few days later, the Health Care and Education Reconciliation Act of 2010 was passed by the House. Then it was passed by the Senate on March 25th and signed into law on March 30th. And the second bill changed portions of the first bill. So a lot of confusion came up and exactly what was contained, what survived, and that's where some of the confusion comes in. What I'm going to try to do is explain both bills, explain exactly what's in there and what do you have to do. But again, please remember this, there are some changes that are effective right now, and I'll be explaining that. Others are going to be effective for plan years beginning after September 23rd, 2010, others in 2011, others in 2012, more others in 2014, and even others 2018. And that's what makes it extremely confusing to go into this and try to keep all this stuff straight. Now, we're going to be talking about group market reforms, and when I say group market reforms, it is controlling both insured and self-insured plans. I'll be talking about preserving and expanding coverage, health insurance market reforms, and this is involving both insured and self-insured plans, grandfather plans, which are extremely important because in this situation, some of the changes are in these bills will not apply to a plan, and a grandfather plan is a plan in existence as of March 23rd, 2010. That's an extremely important term. The problem with grandfather plans is that we don't know if you make a change to your plan, whether all the different changes come rushing in. We don't know at this point. That portion, though, was very unclear, and it's extremely important to remember. We're talking about the impact of collective bargaining plans, and the most controversial area we're going to be talking about is employer mandates. Employer mandates don't come into 2014. Not every employer will be mandated. Only those employers with 50 or more full-time employees, they're required to have coverage. If an employer doesn't have coverage, there's going to be an excise tax that the employer has to pay. Also in 2014 will be individual mandates. So in 2014, there's both employer and individual mandates that come rushing in. So it's not right away. That's one of the sources of confusion. Some changes, again, are effective now, are effective in 2000 for plan years beginning after September 23, 2010, others in 2011. So that's where it gets totally confusing. So let's look at this. And in slide 4, we talk about group market reforms. And again, this applies to both insured and self-insured plans. And these changes are generally effective beginning on or for plan years beginning on or after September 23, 2010, unless otherwise specified. So this is extremely important. These changes are coming up rather quickly. First of all, let's look at lifetime changes. And what we're looking at here is, and what this law says, is the fact that no longer can employers have any lifetime limits on what we call essential health benefits. Well, what is essential health benefits? Well, fairly soon, Health and Human Services will define that term. And you'll see that term throughout the presentation. What does that mean? It means these following benefits: ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drugs, rehabilitation services and devices, laboratory services, preventive and wellness services, and pediatric services. So therefore, for plan years beginning after that date, September 23rd, no more lifetime limits. So what does that mean? Well, if you're going to increase the risk of the insurance company, are they going to take it? Are they going to raise rates in order to buffet themselves against this new requirement? So this is one area that I think is going to raise rates. And insurance companies will raise rates to anticipate greater risk. This is one important change that may increase your premiums. And as you can see from slide 4, it's coming up fairly quickly.